3.
Hello, so I'll knock on my patient's door, they'll let me enter. I do my hand hygiene. Good afternoon, my name's Claudia. I'm gonna be your student nurse for today. This week we're doing an assessment on mental status and cranial nerves. So before we start, I just wanted to ask you if you've been having any problems with your memory recently, or any problems remembering anything.
No, never.
No? Okay. So first, we're just going to start off. I'm just going to be looking at your general appearance, and then I'm going to ask you a few more questions after that.
Okay.
So just by looking at you, I can see that your posture is nice and erect. You're nice and relaxed. You're dressed appropriately for the situation. Your hair is nice and groomed. Next, we're going over behavior. So my client is obviously alert and awake. My client's responding to me. His mood is appropriate for the situation. Next, we're going over cognitive function. So I'm just going to ask my patient a few questions. We're going to look at patient or the orientation of person, place, time, and situation. So can you tell me what year it is right now?
2020.
Wonderful. What's your name?
John.
Okay, where are we at right now?
We're at my house.
Okay, and what are you here for right now?
I'm here for assessment.
Okay, wonderful. So my patient is alert and oriented ×4 to person, place, time, and situation. So cognitive function is good. After that, I'm going to do a few assessment tools for screening for anxiety, depression, and suicide. So I'm just gonna go over a few questions with you, and what you have to do is just respond with never, most of the time, or always.
Okay.
So first question, have you felt super anxious that you are not able to function?
Never.
Never. Have you, within the last 2 weeks or ever, felt so worried that you can't stop worrying?
Never.
Okay. Next, we're going to screen for depression. So, have you ever felt within the last 2 weeks, or just ever in general, like you are losing pleasure in any of the things you've been finding that you like recently?
Never.
Never. Next question, have you felt in the last 2 weeks or ever like you're down or depressed or feel hopeless?
Never.
Okay, so next we're gonna screen for suicide. First, I want to ask you, have you ever felt like you no longer feel like living?
Never.
Have you ever felt like you wanted to hurt yourself?
Never.
Never. Okay. So my patient screened negative for anxiety, depression, and suicide. So after that, we're going to go over our cranial nerves. We're going to test them all. We're going to start with testing cranial nerve number 2. So we're looking at peripheral and central vision. So referring back to the Snellen eye test that we did, my patient has 20/20 vision in both of his eyes. So what that means is my patient can stand 20 feet away from the Snellen chart and see what a patient normally would from 20 feet away. The second part of our cranial nerve number 2, we're testing our peripheral vision. So we're going to do that with the confrontation test. I am going to have my patient put up a set of cards in front of his eye, and I'm going to do that with my same eye. My patient's going to tell me when he can see my finger from his periphery. So we're standing here and looking straight at me. I want you to say when you can see my finger.
No.
Okay, now from down here.
No. No.
Okay,
No.
without looking around. Okay, now with your other eye, switch it. Now with looking straight at me, tell me when you can see my finger.
No. 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 No.
Okay, so that concludes the confrontation test. After that, I'm going to check cranial nerves 3, 4, and 6. So first we're going to do the 6 cardinals of gaze. And by that, I'm just testing our extraocular motion. So I'm gonna have the patient, without moving his head, I'm gonna have him follow my pen light and the 6 positions of gaze. So we're gonna be following the pen light and always going back to the center. And we're making sure that both eyes move symmetrically. And then we're gonna do accommodation, so follow the pen, and it's gonna go to your nose. And for accommodation, we're testing and making sure that our pupils constrict and go inward, so they converge. And then after that, I wanted to do the pupillary light reflex, so just look straight ahead at me. And when I shine the light in your pupil, both pupils should constrict in both eyes. So we tested cranial nerve 3, 4, and 6. After that, we're gonna go on to testing cranial nerve 5. And by that, I'm gonna have the patient clench his teeth. And I'm making sure that I feel his muscles here tighten up. And then I'm gonna have the patient close his eyes, and I'm gonna touch his face with a cotton ball. When he feels it, he's gonna tell me when he can feel it.
I feel it.
Did you feel it?
No. No.
So I was just touching forehead, cheek, and chin with the cotton ball, and we're testing cranial nerve number 5 for sensation. After that, we're testing cranial nerve number 7. So we're going to be looking for symmetry of the facial features. I'm gonna have the patient smile, then frown, and then show your teeth. Now shut your eyes really tight. Now raise your eyebrows. Perfect. And so now everything is symmetrical. All his facial features move simultaneously. So cranial nerve number 7 is intact. After that, we're testing cranial nerve number 8. So I'm gonna do the whisper test on each side. I'm just gonna whisper something in your ear and you're gonna repeat it back to me.
Red, yellow socks.
Okay, I'm gonna go to the other side.
Purple big lamp.
Okay, that was perfect. So our cranial nerve number 8 is intact. Now we're testing 9 and 10. So I'm gonna have the patient open his mouth and say ah. And when the patient does that, when he says ah, our tonsil and the soft palate in the back of our mouth is supposed to rise. So that is testing cranial nerve 9 and 10. After that, we're testing cranial nerve 11. So we're testing the resistance. So I'm gonna have the patient turn against my hand, turn against this hand, and then shrug your shoulders up against my pushing down. Perfect. So 11 is intact. Lastly, we're gonna check cranial nerve 12 and just stick out your tongue. And we're just looking to make sure that the tongue is in the midline and not deviated to each side. So all our cranial nerves are intact, and that concludes this week's assessment. Thank you.